An IVF treatment cycle has lots of advantages, and that's what I'm going to be discussing today. So watch the entire video. I'm Dr. Malpani. I run Malpani Infertility Clinic, and our website is at www.drmalpani.com. Now, most people understand that IVF is an extremely valuable treatment option for infertile couples. In fact, it's the final common pathway, which means if simpler treatment options have failed, or if you have a problem like zero sperm counts, low sperm counts, blocked tubes, no matter what, we can do IVF for you. And of course, with third-party reproduction, whether it's donor eggs or donor sperms or donor embryo or surrogacy, there's actually no couple in this world who can't have a baby using IVF, which is very reassuring to know. But also remember that IVF is not just a therapeutic treatment option. It also gives us valuable diagnostic information as well as valuable prognostic information, and that's what I'm going to focus on. We all understand that in an IVF cycle, as far as the treatment goes, what we're doing is what's not happening in your bedroom, we're doing in the laboratory, which means what's not happening in your fallopian tubes, we're doing in our test tube. We're taking the eggs, adding the sperm, making an embryo, growing it in the lab for 5 days, and then transferring the blastocyst back to the uterus. And you get pregnant, happy ending. But it also gives us very valuable information which you couldn't get any other way. And that's what I want to talk about. Diagnostic information. What does that mean? It means, for example, if you do IVF, we get a very good idea of how well your ovaries actually respond to the superovulation treatment. Now, people sometimes get a little bit confused. Hey doc, I'm young, I'm going to have good eggs. But that's not necessarily true. Or my AMH level is normal, or my antral follicle count is fine. Remember, these are static measures, which means they allow us to estimate what your ovarian reserve is. But there's a big difference between ovarian reserve and ovarian response. The reserve is a number. The antral follicle count could be 7 or the AMH could be 2 or whatever. But the response is dynamic. It actually tells us how many follicles you grow and how many of these contain mature eggs when we do your IVF cycle. And that information you just can't get any other way. So that's important as far as diagnostic information goes. Equally important, we can actually look at the quality of the eggs. Now remember, ultrasound shows us follicles. These are just black bubbles. We don't know what's inside them. With IVF, we can actually stick a needle and take out the eggs. And when we're doing ICSI, we can strip the surrounding cumulus cells, so we get to actually see the egg quality. If the eggs mature, are they what are called metaphase 2? Are they immature? Are they cytoplasmic vacuoles? What do the cytoplasm of the egg look like? Very valuable information. You can't get it any other way except by doing IVF ICSI. And equally importantly, when we do IVF, we get a chance to see if the sperms are capable of fertilizing the egg, because you may have a normal count, you may have normal motility, but sometimes the sperms just don't function. They're not able to fertilize the egg, and the only way to test that is by actually doing IVF. So the diagnostic information you get is both ovarian response as well as sperm fertilizing ability as well as egg quality. And this is where the prognostic information comes in, because patients are often confused. What do we do next? I'm 39. Am I likely to grow enough eggs? Is it worth trying with my own eggs? Should we use donor eggs? And we try giving them well-informed advice. We can quote statistics or numbers or figures and say the chance of getting pregnant after you're 38 with your own eggs is, let's say, 5%. And patients don't care about 5% or 10%. They want to know what their chances are. And that's hard to predict based on just an antral follicle count or an AMH level. But an IVF cycle will give us that information, so that if we do an IVF cycle and she has a poor ovarian response, or the egg quality is poor, or the eggs don't fertilize, then we can tell her, look, the problem is with your eggs. We tried our best. It didn't work. You can now move on to consider using donor eggs. And that failed IVF cycle causes heartburn. I completely agree with you, but it also provides valuable information. So you're no longer paralyzed into inactivity. You now have a sound medical reason for moving on and considering third-party reproductions, such as donor egg options or donor embryo options. And if you want to find out more, please feel free to reach out to me. I'm Dr. Malpani. I offer a free second opinion on our website at www.drmalpani.com. Look forward to seeing you on the website. And if you have more questions, very happy to see you in the clinic as well. We do Zoom calls, and of course, we actually seeing and treating patients because we've been operating smoothly so far and will continue doing so. Bye.